All right. So this is our second patient case. And I do not mind saying that this is my favorite patient. It's probably like children. You're probably not supposed to have favorites, but I do. And it's this patient. So she was 31 at the time of diagnosis. She had initially self-palpated a left breast mass, and she had noted left nipple changes and some skin flaking. So workup was completed. She ultimately underwent a left breast lumpectomy. And here you see the final pathologic staging, which was T1C and 0, but with micromets in one of the lymph nodes. So some other factors, she had ductal histology. She had not a super big tumor, but not a super teeny tiny tumor either, 1.5 centimeters, high grade, strongly ER positive, HER2 negative, a high Ki67, and then also a high oncotype score. So one of the reasons that I love this patient is because she is so positive, but also because she is so willing to be a partner in her care and just do whatever it takes, right? So we recommended chemotherapy clearly, and she started it and she completed it. And then she did radiation therapy. And then we initiated her on an ovarian suppression plus an AI. And she had all the side effects. And you just see that. You see that in this age group. She was 31 when she was diagnosed. And this is a time in these women's lives when they're like flooded with estrogen. And then you take them and you drop them and they feel it. And so she had fatigue and vaginal dryness, and she was always very achy. She had the arthralgias. At some point, we repeated her bone density scan, and she had developed osteopenia. And the thing is that she would have continued this for as long as we asked her to. She is so motivated. And we ordered breast cancer index a little bit later than we typically do. Our standard is more like 4 to 5%, or between years 4 and 5. But we ordered it 5.5 years, and then this was the result. And that predictive value was no. And her prognostic score was not super high, not super low, but not super high. And she was thrilled. She was so pleased to get these results because she wasn't unhappy, but it was a struggle. And when I gave her these results, she cried. I may have cried. And she has since discontinued therapy. And she told me at one of our more recent follow-ups that she feels like she got her life back. And I just can't, I can't want anything more for patients than that. The whole purpose of what we do for these patients is we take them through a time in their life that's very difficult. And then our goal for them is to get them to the other side and have them just return to their life. And I feel like that's what she's done.
Right. And especially, she was only 31, so she's still very young. Mm-hmm. So she's got a lot of life to live. And some of her struggles, we talk a lot about some of the more serious adverse effects of therapy. Of course, osteoporosis and fractures can increase mortality, right? Hip fractures increase mortality. But there are also the day-to-day things, right? Just how you feel. And things that we're learning more about, like cognition. That's something that I hear a lot about, and it's very difficult to quantify the effects of endocrine therapy on cognition, but we see it all the time. So I think that mattered to her. This patient in particular always struggled with her weight in a way that she was always very positive about everything, but this was clearly something that had affected her life. And a lot of our therapies, endocrine therapy is associated with weight gain, and that matters for self-image and goes beyond just, is somebody being vain? It's so much more than that. And so she's doing great. She had bariatric surgery, actually has lost a ton of weight. She looks and feels great. She's exercising all the time. It's pretty amazing.